I'm Jaki Johnson. I'm a registered nurse and a certified diabetes educator. Thank you so much for wanting to join our Camp Nejeda medical staff this summer. This video is to teach you how to properly document at camp. There are a lot of different papers that we go through. I'm going to go through each one in order and show you how to document properly. All right, let's go over the outline for our video today. First, we're going to talk about medical abbreviations, both approved and do not use abbreviations. Then I'll go through how to document in the Kardex. Then I'll go through filling out the bottom sheet of the Kardex and using all of the resources we have to fill out that bottom sheet. We'll go through a sample meal using the cheat sheet to calculate the insulin doses, how we find the carb counts, how we document event cards in between meals, and finally filling out the bottom sheet completely. Then we'll move on to our MAR, our medication administration record for both scheduled and PRN medications, then the health center logbook, and lastly, progress notes. So before I talk about all the documentation, I want to just go over some abbreviations we use at camp and some do not use abbreviations. So first, abbreviations we use at camp, we have AC and PC for before and after meals. More commonly, you'll see the meals just written with either BB for before breakfast, BL for before lunch, BS for before supper, and BT for bedtime, right? We also have PRN, of course, as needed, C and S for with and without, BS for blood sugar, and then we have Q every, so like Q 4 hours, Q 2 hours, BID, TID, and QID for 2, 3, and 4 times daily, respectively, and PO by mouth. Now, the do not use abbreviations here are very important because we do still document on paper with, pen and paper. So making sure we don't use these abbreviations is very important to avoid confusion, particularly when it comes to insulin doses. So the first do not use abbreviation are U, capital U or lowercase u for unit. These are often mistaken for zeros or fours and are often a huge issue, particularly given, say you were to write 4 units, especially if you write it a bit sloppy like I just did, that can look like 40, so it could mean 40 units. This is why this is a do not use abbreviation. So here at camp, we typically leave it out completely. We don't use unit, we just put the numbers because all the places that it's documented, it is understood that insulin is dosed in units. Alternatively, if you ever feel like you want to write and make it clear that it was given, you can write unit all full out the entire word, but never just U. Same thing for IU for international units, can be mistaken for many things, so if you ever need to write it, write out the full international unit. The next is QD and QOD. We don't use these because they're often mistaken for QID or for each other. So it's always a good habit, please write daily or every other day. Especially important for our PO meds, make sure you write the full word daily. Now, another important one are trailing and leading zeros. We never want to use a trailing zero, and that's because, say for a 4, if you were to write 4.0 units, that point could get missed, and now we have 40 units. Same thing for the leading zeros. We always want to have leading zeros, because if you were to write just 0.4, if that point is missed, that could be 4 units. These are big medication errors. So we always want to have leading zeros, so 0.4, and we never want to have trailing zeros, so just 4. Very important for that Kardex. The last one I'll talk about are mg or grains. These get mistaken all the time, and it's been standard of care for a long time to write mcg for micrograms, and please do not use grains. Write out the milligrams or the micrograms for that medication, never in grains. All right, the next thing I will talk about is the documentation of time. At Camp Nejeda, we go with the AM-PM system. So that means anytime time is written, it needs to be followed with either AM or PM. We do not use military time at camp, although I know it's commonly used in many hospitals. It's very important to use AM or PM and to not leave them off. because there's a big difference between 3 p.m. and 3 a.m. All right, so first we're going to talk about how to document in the Kardex. So the Kardex is an old name that comes from, we used to have a real Kardex, if you remember what those are. Now we just have binders. So they're legal size binders, one for each cabin, and it each has the documentation for each camper. And the documentation looks like this. There's a top sheet that has all the information about the camper, their insulin regimen, A1C, who their doctor is, that kind of stuff. And then the bottom sheet for each camper will show exactly what happened at camp. All the blood sugars, the insulin doses, pump site changes, all of those things. And those will be in the binder like this. This is the top sheet, which is where all the information about the kid is going to be placed. So first we'll start with what session they're at. So we'll say the year 2019. We'll say session 1. Or you can also write in here if it's a special weekend, like a BFF weekend, if it's fall or spring, we would put that in here. Then we will move into the general information about the patient, or the camper, sorry. So let's do Joe Smith, of course the name, right? Then we have their spec number. So their spec number is a unique identifier that goes with each camper. It makes it easier to figure out who is who, and we're not just finding the second Catherine that happens to be there. Are you Catherine S or a Catherine M? We don't have to deal with that. So we have spec numbers. So let's say, for example, this kid's spec number was 42. We write in their age, let's say 8 years old. Any allergies they have to anything, write it in. Or of course, if there are none, we would do no known allergies, right? For seizures hypo, if they've had any sort of significant hypoglycemic events, like a seizure or a severe hypoglycemic event that required external assistance, we would write that in here. So let's say that he had a seizure back in January of 2016, right? We would, of course, put their weight, let's say 40 kilos, and the rest of this is all the parts of triage. So triage is done in lots of different sections. Each section has their own part, and they'll fill out each part. So we would do a temp in Fahrenheit, of course, a lice check, which we would just say positive or negative. Of course, positive, that's a whole other thing we'll talk about. So mostly they're going to be negative here. And feed exam would also be, negative. If you saw any cuts or bruises, weird things like that, you would write them in. Then we say where they're putting their sites, right? So there are actually 2 different top sheets. We have one that is for pumps and one that is for kids that are on injections. This top sheet is for a kid that is using an insulin pump. So here it says cannula insertion sites, meaning where they're placing their pump sites. So you would circle all the places they are. Most kids are going to use both arms, both legs, maybe both sides of the stomach, but let's say he only likes the left side of his buttocks, the left hip, right? Who knows? So you put all the different places that they like to use. If it's literally all of them, you would circle all. Then the condition of their site areas, right? This can be most of the time good. If you notice any lumps or bumps, what we call lipohypertrophy, you would write those in here. So you would say good, or I would put lipo on the right arm, right? And if it's very severe, you might write something like severe. So that way anyone that's taking care of this kid knows, oh, don't let him put any sites on his right arm. Then we would move to the other side of the page. So now we'll move on to the right-hand section of this page. First, we'll write in who their diabetes doctor is. Let's say Dr. Sample, right? We write their last A1C. Let's say this kid was 8.3, right? Onset date, when they were diagnosed with diabetes. Some kids will know the exact day. Some might just know how old they were. Some parents are better at remembering than others, but as much information as you have, you can put in. So let's say January of 2013. And then we also have the age at onset, right? So if it was 2013, so that would be 2, right? And how many years with diabetes, right? So all of these things are really the same thing, and you can extrapolate each one. Exercise, how much exercise they do at home. Active, moderate, sedentary. This kind of helps us adjust basal rates, so it's important to ask and see how often they're doing exercise at home. what insulin type that they use, and this is the brand of insulin that they use, so make sure you ask. A lot of parents will not know the name of the brand. They might have it with them, they could show you, but it's important to log that because they will receive the same type of insulin at camp. Then we have the pump type, which pump they're wearing. This first is the brand, right? So there's many different brands, and you would ask, let's say this kid is using an Omnipod. Then you would write the serial number of the Omnipod. It often has letters, a few numbers, things like that. So you would write that in. And the date that they started using this pump. Let's say he started using it just last year, right? Then if they're wearing a CGM, a continuous glucose monitor, or a sensor, as many parents call it, you would write in what brand of sensor, let's say a Dexcom. And then you would write in when they inserted the sensor for that Dexcom. Most parents will do it that exact same day, so you would write in that day. And then where they're putting it. Typically it's going to be the abdomen or the buttocks. So now we have the camp protocol. Down here we have for medications. If the kid is taking another medication that is not insulin, like an allergy medication or something like that, that needs to be given at a certain time, we would write down what time of day that camper receives that medication by putting a red Y there. So let's say this kid takes allergy medications in the morning every day. We would put a red Y right there. So this section is what we refer to most of the time while we're working at camp. This is their current insulin regimen and is updated at all times. Next, I'll show you how we make changes. All right, so this next section is where the endocrinologist working at camp will make changes to the insulin regimen during camp. So let's say, for example, our kid is having a lot of low blood sugars overnight. So the endocrinologist wants to give a little bit of less insulin overnight and at bedtime. So how we would do that, you would come, there would be a sticky note right here, and it would alert you that a change has been recommended. The date of the change would be written here, and then what he's changing. So if he's changing a basal rate, let's say he's having those lows overnight. So let's say the doctor wants to change the basal rate, the midnight basal rate. He wants to drop that from 0.9 to 0.8. And he wants to change the 9 p.m. basal, that 9 p.m. to midnight basal. And right now it's 0.8, and he wants to drop it to 0.7. He also wants to change the carb ratio at bedtime. So he would write down bed, and then the carb ratio he wants to change it to. So right now it's 1 to 16. Let's say he changes it to 18, giving a little less insulin at bedtime. So you would come upon it like this. You would go ahead and make the changes, and I'll show you how to do that next. Then you would initial that you made those changes, just like that. Let me show you where to make the changes. So this is the reason this section is in pencil, because this is where we make our changes. So right after you made the change in the camper's insulin pump, you would come and write down those changes. So we changed the midnight basal rate from 0.9 to 0.8, and he changed this 9 p.m. basal rate from 0.8 to 0.7. Then he also made a change to the bedtime carb ratio. It's no longer 1 to 16, it's now 1 to 18. So you would make those changes right there. Also, at the end of triage, you want to sign your intake signature. This is typically the endocrinologist or the CDE that finished out their intake. So I'd go ahead and sign this and make sure you're putting your credentials. All right, so the top sheet for campers on multiple daily injections or MDI is a little bit different in this section. Now we have the home regimen and the camp regimen, but instead of all the basal rates, we now have long-acting insulin instead, right? So we'll fill in what the camper is using at home. So let's say they're using a target of 100 all day long. They're also using a sensitivity of 40 all day long. But let's say, again, their carb ratio is going to change. A little more here, a little less here, right? And then the long-acting insulin dose. We'll write in how many units they receive of their long-acting insulin in the box that corresponds to the time that they receive it. So let's say this kid gets 30 units of Lantus at bedtime. So we would go ahead and write 30 right there. No need to write units or the name of the insulin. That is all implied and written other places. Then we would do our camp regimen. Once again, these are the changes that the endocrinologist or the CDE is doing at intake, and they'll all be written down here in pencil. So let's say we kept the sensitivity the same, just like we did for our kid on the pump. And again, we'll change the carb ratio slightly, just like we did with our kid on the pump. For the long-acting insulin, let's say the endocrinologist decided to lower the long-acting insulin dose, but kept it at the same time. So now there's 27 units of Lantus at bedtime. And again, same thing for the medications. You put a red Y where the medication is going to be given. All right, over here, the change orders from the endocrinologist look very similar to the pump. Instead of basals though, now we have long-acting insulin. So let's say we have that exact same issue. Our camper is having low blood sugars overnight. So let's say we'll lower his long-acting insulin and decrease the amount of insulin he gets for carbs at bedtime. So right now he's getting his Lantus at bedtime, so they would write bed with a new dose, let's say, of 25 units. And then also the carbs at bedtime. So it would be written bedtime. And the carb ratio, let's say they changed it again from 16 to 18. So this is what you would receive. You would make the changes in pencil on the other side, and then go ahead and initial when you made those changes. All right, let's go ahead and make the changes the doctor has ordered. So we changed this long-acting insulin dose from 27 to 25, and he changed our carb ratio at bedtime from 16 to 18. Done. So now we're going to move on to the bottom page of the Kardex. First, we just fill out the top section, just what we had before. It was 2019 and session 1. Then we would write out the camper's name. This was Joe Smith. He was with his spec number was 42, and he was taking Humalog insulin. You'll see on this page, we have all of the days of camp down the side here, and we have all the times of day here. So we have breakfast, lunch, dinner, bedtime, and then many other times. We have in between breakfast and lunch, lunch and dinner, dinner and bedtime, and then we have overnights, and way over here on the side, we have notes as well. Then we have many, many different boxes in between. This is where we're going to document all of our information about blood sugars and insulins. And then underneath each of those sections, we have a space for initials. So every time you're documenting anything in these boxes, you want to initial the documentation that you've done, so anyone who's looking at it knows, this was Nurse Jackie who did lunch this day. For all of those initials, we also want to put our initials down here. You would start that whenever you're taking care of a kid for the first time. So let's say I just met Joe, it's his first time at camp, as is mine. So I would write my initials here, and then I would sign my name right after it, along with my credentials. All right, let's move in and I'll show you how we document each meal individually. All right, so to explain how to fill out the bottom sheet and to make it easier for you guys, we've developed what we call our cheat sheets. These are just for you. We don't keep them anywhere. After we're done filling them out, we actually recycle them. But they help you to be able to calculate the insulin dose, and these boxes actually indicate what boxes to place which numbers in on the bottom sheet. So we'll go through it as if we're at camp and we're going to do it. So let's say before the meal, we receive from the campers their blood sugars and how many carbs they plan to eat. Those two numbers are what we use to calculate the dose, along with our camp protocol. So we'll start at the top of the cheat sheet. Of course, we'll write in our kiddo's name, their spec number. Let's say it's the 3rd day of camp. And let's, for example, do breakfast. Each of these signify a different time of day. So we have before breakfast, before lunch, snack, which we don't do anymore, before supper, and bedtime snack. Now, up here we'll put our present glucose, so the glucose that they have right now. That'll come to you on a sheet from the counselor with all the entire cabin. So let's say Joe, spec number 42, his present blood sugar is 162. So we would write that in there. The other piece of information on that paper you'll get from the counselor is how many carbs Joe plans to eat for the meal. Let's say he plans to eat 55 grams of carbs. Pretty average, right? At camp, we actually do carb coverage in 2 parts. Ideally, we would give all of the insulin coverage for carbs before eating, but sometimes our kiddos choose to eat more at a meal. If they do, then they all count their carbs during that meal, and we cover the rest of it after the meal. That section I'll go over next. But for example, before meal, let's start with that. So now we need to take in our numbers from the camp protocol, right? So the 3 numbers we always use to calculate are the blood sugar target, the insulin glucose ratio, the insulin sensitivity factor or correction factor, it's a lot of names for this one, and the carb ratio. So we'll input those into our cheat sheet. So at breakfast time, his target is 100. So we'll go ahead and put the target right here. And at breakfast time, his sensitivity factor is 40. So we'll go ahead and put that right here, because this is where we write our sensitivity factor of 40. And then at breakfast time, his carb ratio is 11. So when we divide by our carb ratio, we'll write 11 right here. Now we're ready to bust out our calculator and do some calculations. So the blood sugar is 162. We're going to subtract our target of 100, which will give us 62. Then we'll bust out our calculator, do 62, and divide that by 40, which will give us 1.55, right? Now, we'll move to the carbs. So we have 55 grams of carbs, and we're going to divide that by our carb ratio of 11. So 55 divided by 11, nice and even, 5 units, right? Now we have our 2 halves to our whole, the amount of insulin for correction and the amount of insulin for carbs. So we need to add our correction and carb boluses together, which gives us 6.55. So you might need to round this a little bit. If you do, we always round down at camp. So for this kiddo, before the meal, he's going to receive 6.5 units as his total bolus. So let's say we gave Joe that 6.5 units, he gave it with his pump, and they went off to breakfast. Had a super fun breakfast, sang a lot of songs. After breakfast, you will receive this sheet from the counselors. It will list all of your campers' names, spec numbers, their estimated amount of carbs, and then how many carbs that they actually ate. So we would find our kid, Joe, 42 grams, his spec number is 42. He estimated he was going to eat 55 grams of carbs, but he decided to eat a little bit extra, and he actually ate 70 grams of carbs, right? And you would see that for each of these campers. So when they actually eat more grams of carbs, that means after the meal, they need to receive more insulin. So for example, with this cabin, only Charlie would not have to come to the table after the meal because he estimated he was going to eat 60 grams, and he sure did. So he doesn't need any more insulin. Be especially wary of kids like Kyle or Fernando that estimated very low amounts of carbs, and they ate very large amounts of carbs. We need to make sure they receive insulin for these carbs, or they're going to have a very high blood sugar. Also a good opportunity for educating in the future to plan what you eat and eat what you plan. But regardless of that, let's walk through Joe's insulin that he needs after the meal for these extra carbs. All right, so Joe has come back to the table after the meal, and we know now that he's eaten 70 grams of carbs when he planned to eat 55. So we'll fill out this section to figure out how much more insulin to give him for the more carbs that he ate. So for actual carbs eaten, we put the total that he ate, which was 70. We subtract the planned carbs that he ate, which was 55. So 70 minus 55, we get 15 grams of extra carbs. Now we want to divide that by our carb ratio. So we go back to breakfast, our carb ratio is 11, so we divide by 11. We bust out our calculators, and we get 1.36. Now note, we cannot give 1.36 units, but we can give 1 units. So we will round it down, so he will get 1 unit, right? So now we have the entire cheat sheet filled out, so we can fill out the bottom sheet of our Kardex. Let me show you how to do that. All right, let's fill out the bottom sheet. So we have over here the dates. So Sunday, let's say, was June 2nd, Monday, June 3rd. we have examples here, the units written in to help you fill out these boxes. We have milligrams per deciliter in this box right here. So this is where we would put the blood sugar. Down below it, we have two boxes, both for carbs. The pre, how much insulin we gave for carbs before he ate, and extra, how many carbs he ate after eating. So these two boxes are for grams of carbs, how much we bolused for before, and then how many extra we bolused for after. So for example, if we don't want to write totals in these boxes, it'll be the total before and then extra. So you wouldn't write 55 and 70, you would write 55 and 15. So over here we have units of insulin. Up top is the units of insulin for correction, how much insulin we gave because of this blood sugar. Right below it, we have the insulin we gave for carbs, how much we gave before eating, and then how much extra insulin we gave after eating, both for carbs. So let me show you how we put that in. Notice on our cheat sheet we have certain numbers that have big black boxes around them. If it has a black box, that means that number needs to go and be written on the bottom sheet. So our first number up here, the glucose, has a big box around it. That's 162. So we want to put that right here, 162, right? Then our next black box is this correction bolus, how much insulin we gave to lower this blood sugar. That was 1.5 units. We would place that right here, 1.5. Then we move to our next boxed item. That's the planned carbs to eat, 55 grams. So he planned to eat 55 grams. That means we gave insulin for it before eating. So we put that 55 grams right here. Now right under that we have our carb bolus. This is the bolus we gave for carbs before eating. We gave 5 units. So we would put that right over here, 5 units. Now on our next part, after eating, we look at our two boxed items here. We have the extra carbs he ate right here, 15 grams. So that would go under extra. We would put 15 grams right here. Then the additional bolus, the amount of insulin we gave for the extra grams after he ate, we would write that right here. Remember that we only gave 1 unit, so we would write 1 right here. So now we have this whole section filled out. So anyone looking at it would see, oh, his blood sugar was 162. He planned to eat 55 grams, but he ate 15 grams more than that. He received 5 units of insulin for the carbs before eating, 1 for the carbs after eating. Now the only thing we have left to do is put initials right down at the bottom. This tells anyone that's looking at this, oh, look, it was Nurse Jackie that did this breakfast. If there's any issue with what happened at breakfast, you could go ahead and find this particular nurse. And that's how we fill that out. All right, so besides documenting each meal, we can also document events that happen between each meal. That's what these boxes are for. So when an event happens, which is typically a low blood sugar, you'll receive an event card. So the counselors fill these out in between the meals in case a kid has a low blood sugar between meals. They treat them themselves, and then they would bring these event cards before the next meal. We would then transpose this information and write it into the bottom sheet of the Kardex. So event cards look like this, has the name in the cabin and the spec number, the day, and then it has what happened. So for example, Joe at 10:15 in the morning had a blood sugar of 62. They treated it with 4 glucose tablets, which is as per protocol, and then rechecked it in 15 minutes. The blood sugar came up above 80, so they gave him crackers. So we want to document this in the appropriate spot. So we find June the 3rd, right? This is what we did at breakfast, so we want to write it here in morning because it happened between breakfast and lunch. So how I would do this, you would write the time with AM or PM, what the blood sugar was, and then what it was rechecked as. So we don't want to write the treatment because we always treat lows as per protocol. If there's ever something that was treated not as per protocol, then you would write it in. But 99.9% of the time, it'll be protocol, so we're not going to write it in. So for example, for this one, I would write 10:15 a.m. and I would put that the blood sugar was 62. And then you could write it like this, that it was rechecked to 89. There's a couple different ways you could write this in. You could also get rid of the arrow and just simply write at 10:30 in the morning, then it was 89. So it shows that it was rechecked in 15 and it was 89, right? As long as all the information gets into this box, however you would care to do it works. You could also do, for example, 10:15 a.m., 62/89. That also kind of gives you that information that they were rechecked, and we don't have to write that the low was treated because it is implied that, of course, the low was treated because that's the protocol. All right, so let's give another example of what can happen between meals. So let's say, for example, Joe got insulin for lunch, then he went out and he started to feel sick. So let's say then he came into the health center because he felt sick. He did a blood sugar test and it was high. Let's say it was 300. And we had him check ketones. And let's say those ketones were small. So in that situation, we would give insulin for correction, assuming at this point it's 3 hours after lunch. Let's say lunch was at noon and this happened around 4 p.m., right? So let's say it happened at 4 p.m., he had a blood sugar of 300, and he had moderate ketones. So we'll want to write that in this box, in between lunch and dinner, the afternoon box. So we'll want to write in the time that it happened, what the blood sugar was, any results of ketones, and how much insulin we gave him at that time. So how we would write this would be at 4 p.m., the blood sugar was 300. For ketones, we typically write the level of ketones and then circle it. So for small would be SM and circle it. It'll be understood how we document this, that this SM means small. Then we would write down how many units we gave. So if it was 300 and he's got that correction of 1 to 40, this would be 5 units. So I would put in 5 units given, right? Then, whenever we're giving insulin in between, we want to make sure we're initialing. So that way, the nurse that covers Joe for dinner would be able to see, oh, his blood sugar was high at 4 p.m. and looks like they gave insulin. If I want to find out more about what happened here, I should talk to this nurse, Nurse Jackie, and she'll be able to tell me more about what was going on and if we did anything else. So that's how you would document a high if you have to give insulin between meals. So let's, for example, look, I went ahead and filled out what happened the rest of the day for Joe. Now, some of these numbers might not be accurate. I just put in some examples. So let's say, for example, at dinner, his blood sugar was 210. Now, we would recheck the ketones because he checked ketones earlier and they were small. So we rechecked and said they were negative. So I wrote NEG and circled it right here. So anyone would know, oh, at this time, the ketones were negative. Then I went ahead. For example, at dinner, he planned for 77 grams before he ate and then ate 11 extra grams. So he did not get any insulin to correct this blood sugar because he already received insulin for this high blood sugar at 4 p.m. and dinner time is around 5:30 at camp, so it's not long enough. That's a whole other thing. But for example, so 0 units of insulin for correction. Then for the carbs, he got 7 units of insulin before eating for this 77 and 1 unit of insulin after eating for the extra 11 grams of carbs, and I initialed it there. Let's say nothing of importance happened between dinner and bedtime, besides general camp fun, of course. And then at bedtime, his blood sugar was 150, he had a 30-gram bedtime snack, and we went ahead and covered that bedtime snack with 2.7 units and no insulin for correction. So this is always how it should look each day. Nice and simple, no big crossouts. If you ever make a mistake, let's say, oh, his blood sugar wasn't 150 at bedtime. I wrote that completely wrong. It was actually 65, right? Instead of making a big mess here, it's always best to make sure the first time you're writing it it's accurate, but mistakes happen. So if we got this wrong, we would simply cross it out and then write in the appropriate blood sugar, right? If there's a low, we always recheck again before we give insulin. So then you would need to write in, oh, it was 65, and then we rechecked it and it was at 110. It can get a bit messy in here with crossouts, so try to minimize the amount of crossouts that you need. But always, on this piece of paper, everything should always be written in pen. And never using whiteout, only crossing out things rarely. Hopefully, you shouldn't have to cross anything out. So now I'll show you how we would document overnights. All right, so next we have our overnights. So we have nurses that are on overnight, and the counselors will check campers overnight. So for example, Joe, he had a low blood sugar at bedtime, so he would be a candidate to be checked overnight. So if he's checked overnight, what will happen is you'll wake up in the morning, you'll look at the sheet, and all of these boxes will be filled out for all of the times that they checked him. So for an example, let's just say he was low at each of these checks, so that way all the boxes are filled. So let's say at 11 p.m. his blood sugar was 62. So of course they would recheck, right? Let's say they rechecked and it was 110, and that's all you'd have to write. You would not write the treatment because treatment is always as per protocol, right? Then let's say he was checked again at 12:30. Let's say it was low again, this time 55, and he was rechecked at 120. Again, you wouldn't write the treatment, just the blood sugars. And the same thing for 3 a.m. Let's say at 3 a.m. finally his blood sugar decided to stay a little more stable and he was 180. So we write all of these down. So this is an example if he's having lows overnight. If he has highs overnight, if it's over 300, he'll likely receive a correction of insulin. So let's say at the 11 p.m. check, maybe he was low, right? And rechecked at 110. But when he was checked at 12:30 a.m., the blood sugar was 335. They would check ketones, of course. Let's say that they were negative. You can also write negative ketones with just a minus sign that is circled. Then they would give him insulin. So let's say they calculated the insulin dose and they gave 6 units. So you would write 6 units right here. So that way they know that that was given, and whatever nurse was the one to give it would of course initial it right here. So that way you know who to talk to about what had happened. And then let's say they rechecked again. It came down nice and quick by 3 a.m. to 150. So that's an example of what it would look like if one of your campers received insulin overnight. So now let's go through the same process we just went through with a kid using multiple daily injections. So let's say, for example, our same kiddo, Joe, Spec 42, before breakfast. Let's say his blood sugar was 176 and he planned to eat 82 grams of carbs. So we would put the 176 right here, and he planned 82 grams of carbs. We would put our target here. So for breakfast, 100, here is the target. Then we would put our correction factor right here. So we know our correction factor is 40, so divide 1 unit per 40. There we go. Then we want to put our carb ratio in. So our carb ratio at breakfast is 11, right here. Now we can do some math. So 176, you subtract the target and you get 76. Then 76, we divide that by 40, which gives us 1.9 units. I'm going to write it right here because 1.9 units is not an amount we can give with an insulin pen. We can give 1 unit, we can give 2 unit. On some kids, they may have half unit pens. Let's assume that Joe has only full unit pens, and that's what he uses at home. So we'll use it here at camp. So I'm going to write it right here because I want to put the final amount in the box because that's what's going to go into the bottom sheet. So we want the rounded numbers in here. So I put it right there for safekeeping. Then we'll do the carbs. So 82 grams of carbs, we'll divide it by our carb ratio of 11, and that gets us 7.45 units. Again, we'll write it to the side because we want to put the rounded units in there. Then we'll add up the correction and the carb coverage. So those two, 1.9 plus 7.45, is going to total 9.35 units. So we know in total, since we round down at camp, we're going to give 9 units. So now we can apportion those 9 units into each part. We don't want to round each one individually, because if we did that, if we rounded 1.9 to 1 and then 7.45 to 7, this kid would actually get only 8 units when he needs 9. So instead, we have 9 units to give, so we'll do 2 units here and 7 units here. See, so that way it's still showing us the total amount that we gave, the 9 units, and about how much was for correction and how much was for carbs. This can be a little hard to write, but it's important that the total still ends up being the same when it's rounded at the end. We always want to round everything at the end. So then let's say he went off to eat. He ate a little more than he planned. So let's say he actually ate 97 grams of carbs. So we would subtract the amount he planned, which was 82, and that would be an extra 15 grams of carbs. Now we divide that 15 grams by our carb ratio of 11, and that would give us an additional bolus of 1.36 units. Of course, we can't give 1.36 units, so we round it down to 1. So we would give 1 extra unit before the meal. So Joe would have received 9 units before the meal and 1 unit after. So let me show you writing that on the bottom sheet of the Kardex. All right, so now let's put it in for Monday's breakfast. We look for all the boxes, and the numbers in the boxes are what's going to go onto the bottom sheet. So the first one, 176, our blood sugar will go right here. The next one, our correction bolus, 2 units for correction, 2 would go right here. He planned 82 grams of carbs, we would put 82 right in there. And we gave 7 units for carb coverage before the meal, 7 goes right here. Then after the meal, he ate 15 grams extra carbs. That's in the box, so 15 goes right here. And then an additional 1 unit after eating, 1 unit right here. And of course, we initial that we gave that. So see, the real only difference is that we don't have decimals anymore. We only have whole units. And that's because with the pens, we can't give these very specific decimals. We can only give the whole units. So we make sure that it still adds up. We gave 9 units before, 7 plus 2, and we gave 1 after, 1. So everything looks great with this. So kids on MDI will take a long-acting insulin, and we need to document every time that we give it. So we have this column right here, and this is where we write the long-acting insulin dose. So for example, Joe Smith is prescribed to take 25 units of Lantus at bedtime. So in this box, we want to put both the time period in which the Lantus was given, bedtime in this case, or BT for short, but it could be at any time of day. Most commonly it's at bedtime, but it could be before breakfast, which we would write as BB, before lunch, which would be BL, before supper, which would be BS, or bedtime BT. So we would write that up here on the top, and then under it we would write the units of insulin that he received for the long-acting. So Joe at bedtime received 25 units of Lantus. And then of course we would initial below because we gave the insulin. Now the other thing I didn't mention is this notes section. I mentioned a couple situations we could use it. One important one is often we will basically change protocol for a certain meal of the day. And we do what's called either half carb coverage or no carb coverage for a meal. We'll do that if the camper has a really exercise intensive activity after that meal. For example, a lot of our evening activities tend to be a lot of running around, which can cause low blood sugars. So there's a special protocol for each of these events, and you can follow up at camp to see what those events are. But if we ever change protocol and give different amounts, we want to note that. So we would put that in this notes section right here. So let's say, for example, Joe at dinner time ended up getting half carb coverage because he was participating in an event right after dinner. So we would note that like this: half carbs at dinner. Very clear. Then anyone looking back, if they're looking and seeing, oh, that dose for dinner doesn't look right, they would just have to look here and see, oh, Joe received half carbs at dinner, right? And then also if there's an event where everybody in camp is getting half carbs for a meal, but there's a specific medical reason why your camper does not require that, you might put full carbs at dinner, just to make it extra clear. And you could write the event that it was for if you have to, but typically everybody in camp is going to know why that happened. So that's another thing we can put in notes. Otherwise, we are done with the bottom sheet of the Kardex. So now we're going to talk about our MAR, our medication administration record. So this is where we document all of the non-insulin medications that our campers take. So during intake, we'll take all of their medications and the intake nurse will fill these out for you. So when you see them as a cabin nurse for the first time, this will already be filled out. But let's fill it out together anyway. So let's say we have our patient, Joe Smith, coming in with this prescription, which I have redacted because that's a personal one. Why not? So we have this medication, fluticasone. It's a nasal spray, and the prescription says 1 spray in each nostril 2 times per day. Now this prescription was written on 10/5/2018. So we want to make sure we put all of that information in here. So the order date for this medication is 10/6/2018, right? And the medication itself. So we would write fluticasone. Hopefully it's an easy to spell medication. The fluticasone nasal, right? And then you would put 1 spray each nostril 2 times a day, or if you're fancy, BID, right? So then next to it, we want to write all of the times that we gave this medication. So since this one is BID, we would typically give it at breakfast and bedtime. So we would put in, or you could do breakfast and dinner as well. It depends on when they take it at home. So that's something the triage nurse would ask, or the intake nurse would ask. So let's say it's at breakfast and bedtime. So times I would put BB and BT. Then you want to put each of the dates of camp. So let's say, the 6/2, 6/3, 6/4, etc., etc. Then in each one of these boxes, go your initials to say that it was given, right? So for the first date, June the 2nd, the kids are coming in, they're being intaked to camp right after breakfast. So we wouldn't have the opportunity to give it there. So you could put a big cross through. But then at bedtime that day we would. So we put our initials right there. And so on and so forth every time you give the medication. So that way by the end of camp, all of these fields should have initials. And then of course at the bottom of this, we have a place to write the initials and your signature. So I would put my initials and then my signature, which is awful, and your credentials, of course, right? So that way, anyone that sees this, oh, so-and-so gave this medication at this time. Now you make sure you do this for every medication that they have. Can, take a few spaces and then put the next one down on the next area. All right, so now let's talk about how we document our PRN as needed medications. Let's say, for example, Joe came with a Ventolin inhaler, and this was to be used only in the event of wheezing or an asthma attack. So we would write down all the information about the medication here. So we have the medication, which is Ventolin HFA inhaler. We would write down the dose. It's always 2 puffs, Q, 4 hours, PRN, right? And the frequency, PRN, right? All of these are PRN. If it was a specific one like this Q 4 hours, you could write that in as well. But typically that's how this is prescribed. So then we would put in any time that we had to give it. Since it's not a scheduled medicine, we would write down the date, the time, and the initial. So let's say that Joe had some wheezing happen after, playing football, in the afternoon. So let's say that happened on the 4th. So we would put the date. Let's say it happened around 4:30 p.m. And then we would initial here to say that that's when we gave it, right? You want to list all of the PRN meds here, and of course, initial any time that you have to give it. You would initial as well down here, and again, sign and put your credentials. Next thing I'll talk about is our health center visit logbook. So kids throughout the day can come in for any kinds of concerns. Say they got a cut on their finger, a small burn, their feet hurt, that kind of thing. So whenever they come in, we need to document it. So these come in spiral notebooks. There will be one for campers and one for staff. There are a couple things to keep in mind with documenting this particular thing properly. We don't want any skipped lines. They really don't like things being crossed out on here. And we want to make sure the date is always noted, right? So whenever the date turns, like it goes from, midnight to the next day, make sure you're logging the correct new date on there. Otherwise, no skipped lines, because these are mandated by ACA for us to do. So let's see. Our kiddo again, Joe Smith, causing trouble, got a cut on his finger. Let's say he came in around 1:30 p.m., right? Let's say this is the newest entry for this day. I would write the date right here, right? That way they know, oh, now we're on the 3rd. We're going to have a lot of these each day, so it's not like each day we're writing one. We're just making sure that that day is written and then all of them are down. We would write his name, Joe Smith, last names please. Unit, we would write our cabin and our spec number. So since he's in cabin 12 and he's spec number 42. Then his health concern. So you can put something literally as easy as cut on left finger. Sure, right? Nothing more descriptive than that is really necessary. And then the treatment. So let's say we gave him a Band-Aid with Neosporin. And that he also washed his hands, because everybody should wash his hands. Then, of course, you would initial right here. These initials should always be done by a licensed individual, either a nurse or a doctor, someone with a license, and make sure there's no skipped lines. So let's say that Joe came again at 4:30, he had cut now another finger. Then we would start it right here. So we would write 4:30 p.m. That again, Joe Smith came in, still the same cabin and spec number. Now he has a cut on a right finger. And this time we told him to get out of here. Just kidding. We also gave him a Band-Aid and some Neosporin. And let's see, he washed his hands again. And of course, we initial again. If you're giving medication, let's say then at 6:30 he came back and was complaining of all this pain in all of these fingers, and now he would like some Tylenol. So of course we would do all the regular documentation we do for PRN medications with Tylenol. We do that PRN medication that I showed you earlier, but we would also write it here. So let's say now he is complaining of finger pain. So let's say we gave him Tylenol, 500 milligrams, PO, and then we would initial right here. So that's really all that needs to be done for this. But really, any camper or any staff member coming into the health center, the reason why they've come in should be documented here. Unless it's a logistical thing. They're coming to refill on glucose tablets, coming to get new test strips, things like that. That doesn't need to be documented here. That gets documented another place. But if they're coming for, nursing care to the health center, we're going to write it down kind of no matter what it is. If it is diabetes related, we do not put it in here. That all goes into our diabetes related documentation. Everything else we've discussed today. This is all not diabetes related stuff. Next sheet I'll talk about our progress notes. So we only would do a progress note for a camper that's going to stay for an extended length of time in the health center. Say our patient Joe Smith, again, our camper, keep saying patient, our camper Joe Smith came and he had a fever and was feeling awful and we wanted to quarantine him in the health center. So if that were the case, we would fill out a progress note for him. So we would, of course, put his name, Joe Smith, the date, let's say it's still the 3rd, there's a lot happening on the 3rd, his spec number, and his date of birth, which I can't necessarily remember. Let's say it's 1/1/11. Sure, that sounds close. I think it was 8. Anyway, so then we would fill out the progress note. Regular narrative note, just like you would do in many nursing scenarios. The important thing that goes on this is non-diabetes related things. So if he's in there for, vomiting that has nothing to do with diabetes, or a fever, or God forbid, a broken bone or something, that's the kind of thing we would fill out here. If they have to stay for a long period of time and they are staying through a meal and they receive that meal and insulin for the meal, all of that would still be charted in the same place in that black cabin binder on those Cardexes, that bottom sheet that we're always filling out diabetes information. But other information would be put here. So you would put, let's say at 10:15 a.m., patient arrived. Let's say he complained of fatigue and nausea. Maybe we'll put that his temp was 101.9 Fahrenheit, right? Maybe we'd say treated with Tylenol. Maybe we put the dose and all that stuff in there. And basically you would just keep going from there, right? So every time there's something new that's happening with this patient, then you would come back in and you would fill that out, right? So, then you would, let's say then maybe at 10:45, maybe he vomited ×3. You wouldn't necessarily need to write, it doesn't have to be super detailed. It's just kind of a regular progress note. All right, so we keep these progress notes in, it's actually like a paper holder, a long one that has many pockets. And each pocket stands for a bed in the health center. So we would put these in the pocket, and then there's like a cover sheet on top of them. So you'll always find them there. So anything new that happens with this patient, you would take the progress note out, write down what it was, and put it back. Then when the kid is, totally good to go back with all the campers, then you would just sign and date the bottom of it and file it as instructed. Great, I hope that wasn't too overwhelming. We only have one last thing to talk about. Let's talk about Hipaa. So of course you guys all know what Hipaa is, and of course we need to keep that in place at camp as well. At camp we have a special agreement that all diabetes related medical information is not subject to Hipaa. So actually, if we have any documentation like our Cardexes that have information about how much insulin kids got at camp and that type of thing, we can actually just recycle those papers instead of shredding them. So it's important any documentation related to diabetes goes into the recycling bin, and we'll show you where that is when you get to camp. Anything else related to things that are not diabetes related will be shredded, and there is a special place to put them at camp. But do keep that in mind. Thank you for watching our video about documentation at Camp Nejeda, and we look forward to seeing you at camp. I hope it was helpful. If you want to review anything we went through, you can look in our description below. There'll be links with timestamps to every section in the video, so you can click it and review anything you'd like to as many times as you'd like to. I can take the views. I'll see you at camp.